Well, we're back right here in the studio. We have with us our first guest this evening. We have with us Dr. Fatma Alawadi. And Dr. Fatma is a consultant developmental pediatrician at Fatma Clinic. Dr. Fatma, welcome to our program, Hala Kuwait, once again.
Thank you. Happy to be here again.
It's nice to have you with us right here in the studio. And Dr. Fatma, this evening we'll be talking about learning disorders.
Yes.
A lot of things going on with that. But first off, can you tell our audience a little bit about learning disorders and the different types of them, please?
Sure. Learning disorders are neurological disorders or conditions which affects one's ability to store, process, and produce information. And hence, it affects the child's ability to read, to write, to spell, to compute math, as well as sometimes it might affect their concentration and focus, their memory, coordination, their social skills, as well as emotional maturity. And there are many different types of learning disorders, and we'll talk about like the most common, let's say 5 of them. The number 1 is the dyslexia, which is very well known now. Even the name rings a bell in everybody's mind. And it is the specific learning disorder that affects reading ability and reading and other language processing.
So this is the most common learning disorder?
Yes, it is. And the other one is then the dyscalculia, which is the disorder that affects the understanding of numbers and learning math facts. And dysgraphia, which affects the handwriting and fine motor skills. Dyspraxia, which affects the more complex motor skills and coordination. And the last one would be the auditory processing disorder, which affects how the sounds are, which travel through the ears to the brain, are interpreted by the brain, and then they are understood.
Okay. Yeah. So tell our audience a little bit more about dyslexia and how that may be diagnosed and so forth.
Right. So dyslexia, as we said, is the most common. It's language-based disorder. So it's a lot about the language and speaking and the skills of language and listening. It affects the children and their reading abilities, and it affects about, let's say, up to 20% of the population.
Is it more common with boys or girls?
It is more common with boys.
It is, huh?
Most of the developmental problems are more common with boys.
Why is that, Dr. Fatma? Is there some specific reason?
Some things, yes. No specific reason, but it's well known.
To be like that.
It seems like that.
Okay.
Yeah. And then, as we said, it affects about 20% of general population as per International Dyslexia Association. And it affects children in different ways and in different severities. So it might affect the reading fluency and speed. So the child will be slower in his reading. It might affect his decoding ability, and then he will have more decoding errors, and especially with the order of the alphabets in the word. And it's strange how the child adapts to his difficulties, and he learns how to read even without the decoding and without knowing the letters by the shape of the word. So the decoding of the new words would be more difficult than decoding of the known words which he has been exposed to. And then decoding the real words is more difficult, is easier than decoding the nonsense words. So sometimes there are some words which are like letters put together, they are not real words, then you need to read them. You might be able to read them, but with dyslexia it will be very challenging for him. And then it can affect the spelling ability and the writing ability, and affects their comprehension. So to have that effort reading and then comprehending what he reads, then it adds to his effort and his attention and his needs and struggles. So there is a big discrepancy between the listening comprehension and the reading comprehension of the same text. So if I read for him that text, he would answer the questions verbally easier, much easier than when he was reading the text and trying to understand it and answer the questions.
So now, how would you go about diagnosing this?
Diagnosing?
I mean, is it easy or it's very difficult?
It's not very difficult, but it's not straightforward, and sometimes it's a bit complicated.
Explain that to parents that may be watching
Of
and
course.
thinking their kids may have dyslexia.
Of course, because when the child goes to school, nobody suspects that he will have any struggle or any problem. Usually the kids who are diagnosed with dyslexia are smart, like last time when we were talking about ADHD.
Yes.
They're smart kids. They
Yes.
have good IQ, they have good abilities, they are doing well in the kindergarten or in the nursery. But then he goes into reading and he starts struggling and shows some difficulties with that. And usually we will say, okay, let's wait and see. So they are not diagnosed until like around 6 or 7 years, and the problems will not like show until 5 or 6 years. But again, I like to emphasize that sometimes preschoolers may show some signs and symptoms which are like red flags, and which
Like what? Some
like
examples.
if he was delayed in speech, he has pronunciation problems, he has difficulties sitting and concentration, learning the shapes, the colors, and the first letters and numbers, learning the orders and following instructions, learning the routine of the class. So there are certain things which are very subtle, but then he needs to do that at that age stage. And if he didn't do it, it will just pass, like he will grow and mature and learn it. But they might be the red flags which can take our attention and suspect that he might develop dyslexia later on.
So these are things that they should look for.
Yes, and these are very important because at that stage, when we talk about early intervention, then that stage is the most important time for intervention, and then you can help him overcome his difficulties and avoid being dyslexic and have more easy time learning to read and write.
Okay, so it is possible to get over a lot of these learning disabilities if you catch it early enough.
It is, of course,
Okay.
although they might say that it is chronic disorders and they will continue there, but usually it does improve with teaching and intervention.
Does it affect the IQ of an individual?
It does not.
Okay,
It does
that's
not
good.
affect the IQ, and the IQ usually is not affected. So we should not confuse the learning disorders with other disorders like intellectual disorders or like autism or other behavior disorders. So usually the learning disorders, IQ is average IQ and average abilities, and sometimes above average abilities. It's just the way the brain works and the brain process information and interprets it.
So doctor, how can parents help their child who may, when they find out they have dyslexia, it may be upsetting to them?
Of
and
course.
How can they support them? Tell us more in detail about that.
The parents are the best people who know their children. So whenever they come with any complaints, we have to take that seriously and not say that she's a mother or he's a father and you expect your child to be the best, he's doing okay, he will be fine. Let's take it seriously and look into him. And the parents can help their children really grow out of or get over these difficulties and achieve success. They can know what are his strengths, and they encourage those strengths, and they know their weaknesses and try to help them overcome their weaknesses. They know about their learning techniques of the child or learning way or style so that he can learn in that way rather than this way. Is he visual, is he auditory, or what kind of learner he is. They can work with professionals, with teachers, with schools, with counselors, with whoever they need, so that they put the intervention plan, they put the strategies which he needs to help him and to overcome these difficulties. And there are so many strategies that can help him and make his life easier.
Tell us some of the main ones, Doctor.
Like the main ones,
yeah.
like let's look at the classroom. So the setting of the classroom, where he is sitting, his seat in the classroom, it's important.
Why, where should he be?
He should be in the front, maybe, so the teacher can have a look at him, maybe remind him what he's doing, and show him. He may need to be given some extra time for his reading or for his schoolwork. Multi-sensory method of teaching is very important in this case, because he needs to involve all his senses, like his sight, his hearing, his even touch and smell, so that he learns these alphabets and these letters, and he can then understand them and blend them and make the words. And also we can give the information in smaller units so that he can have the time and to interpret it and to process it and then understand it and learn it.
Can someone who's diagnosed with dyslexia, Doctor, with time and some of these trainings and some of these things, grow out of it, or is it always will be a little bit there?
There might be a little bit, but they can be, they can overcome it to the level that they can finish their education even in the college and university level. So they can do well with the level of education where level of reading ability that he is. So he can overcome and he can achieve a lot with even if he had mild dyslexia or his dyslexia improved. But sometimes it's very difficult to overcome these, and he can use other types of reading. Nowadays with our present time, there are so many times we can have the books on tapes, we can have them on computers, so there are so many ways that he can read without actually reading.
Are there any other treatment modes that happen where you use actually medication and things like that?
Not really. But if there were some behavior problems or other things going on, he might need medication. But for dyslexia itself, there is no medication. There are some like supplements which helps in attention and auditory processing and so on, so they can use those. But medication doesn't play a big role in dyslexia. But training and skills training and cognitive training are important, because you can train the brain for his auditory processing, for visual processing, for focus and concentration, working memory, and so many skills that are needed as baseline to learn reading. So if you improve these areas, then his reading will also improve.
Dr. Fatma, is it true that people that are dyslexic are quite good in, let's say, different math things and so forth? They're good with numbers, or is that?
They might be, because the dyslexia, as we said, is different than dyscalculia.
Okay.
They can come together. And sometimes the dyslexic, children with dyslexia, where they have difficulties with letters, they might also have difficulties with numbers, but they might not. So they can be separated. So he might be having dyslexia and cannot read, but with numbers he
can be very bright.
He can be good and bright.
Okay, so this is a very interesting topic with a lot of things going on with that.
That's right.
And you feel that these learning disabilities are on the increase that you've seen lately, or how are they? They are, unfortunately.
They are worldwide. They are increasing, but they might be because we are also better in diagnosing them and recognizing them. In older days, they might have been like called other names, but now we call them dyslexia, and we have the way to diagnose them and intervene. So there are so many environmental factors that can play a role in processing skills. So they are increasing, but there are also better intervention methods now.
Now, what about schools? How do schools help out with people with dyslexia?
As we said,
because do they need to? They don't need to go to special schools, do they?
They don't need to go to special schools, but there are some special schools for children with learning disabilities or disorders. But they don't really need to be in special schools. They can be in mainstream, but they need the support, the extra support which is needed for these kids. So if the school is able to give that support, as we said, the certain strategies, certain ways to deal with them, to help them overcome their reading difficulties, then they can be anywhere. They can grow and learn and be happy kid in any school.
Does it affect their social skills,
Of course they do. It does.
It does.
It can affect their social, emotional. I mean, if you go to school and stay there for 8 hours, you're staying there for more than what the time you spend time more than your home.
Yeah.
So and then you feel like a lot of them feel like they are going to jail. Or to prison, and they have so difficult time in school, and it affects their emotion and their psychology. It affects their having friends, because they are prone to be bullied, they're prone to be called names, and they feel really bad about themselves when they see their peers are reading and writing and answering questions, and they can't do that, and they don't know why, although they are very smart.
Yeah, that's some of that, unfortunate. Can that lead to the kids becoming a little more violent also?
Of course, yes. It can lead to hyperactivity, to inattention. It can lead to being more violent. So it can lead to a lot of behavioral problems. But with early intervention, again, you can avoid these things, and helping him and encouraging him and showing him the way and accepting himself and working on himself, then he will be in a better position.
Dr. Fatma, it's always a pleasure to have you on our program.
Thank you very much.
What other last bit of advice as we're wrapping up our interview do you have for the parents who may be watching tonight about dyslexia and
Yes.
general learning
And
disabilities.
general learning disabilities cannot be suspected. So you cannot see a person and you say he has learning disability. So once you feel that there is any kind of struggle, being a teacher or being a mother, any difficulties in the school, please don't wait too long. Just go seek advice, seek help, and take action.
Very well said, and thank you for joining us this evening.
Thank you for having me.
Thank you. It was a pleasure to have you. We were speaking to Dr. Fatma Alawadi, a consultant, a developmental pediatrician at Fatma Clinic. We appreciate her time with us this evening right here on Hala Kuwait. Right now, we'd like to move on to our next report and take a look at the Kazakhstan Embassy event. Let's take a look at this event and see what took place. Stay tuned.